Everyone, I hope summer's going well for all of you. It's certainly been a busy last month for APTA, as we've had 3 events in Washington, D.C. this last month. The first was APTA Leadership Congress in Washington, D.C. A few highlights from the component leadership meetings were APTA is going to be revamping the Find a PT platform, so make sure to update your profile on this. It should be getting more and more user-friendly in the next couple weeks here. APTA is looking to create an advocacy academy, which would help foster skill development in the advocacy realm. And also, both APTA and FSVPT sent letters to Lifetime Fitness to address the DPT issue. Right after Leadership Congress wrapped up, the APTA House of Delegates was held in Washington, D.C. There were 440 delegates from all around the country, and Minnesota had 10 voting. Our chief delegate, Lindsay Vandenberg, will be sending out a summary of the motions we voted on soon. Here you can see our Minnesota delegation present. You can see a little bit of the setup of the room. A couple of our Minnesota reps speaking at the microphone. And then I also included a picture of how we actually vote. And then this week's committee feature, or this month's committee feature rather, is the Federal Government Affairs Committee. Jackie Lasik is APTA Minnesota's federal advocacy liaison, and she did a great job helping to coordinate PT Day on Capitol Hill, which was in Washington, D.C. as well. It's always an inspiring event to have so many people, really hundreds of people, all lobbying for our profession at the national Capitol. Minnesota had 12 people fly out to meet with our legislators or their staff. These are the bills that we discussed this year. I'll go through and just mention each of them, but if you'd like to dive deeper, I'll provide those links at the bottom like usual. Strengthening Medicare for Patients and Providers Act, which would institute annual inflation-based updates to the Medicare physician fee schedule. A PTA supervision bill, which requests that Medicare allow for general supervision instead of direct supervision in outpatient private practices. Prevent Interruptions in Physical Therapy Act, which would allow physical therapists to use locum tenens arrangements to bring another licensed PT to treat Medicare patients and bill Medicare through the practice provider number during temporary absences such as illness, vacation, etc. Physical Therapy Workforce and Patient Access Act, which would provide patients the ability to access their Medicare or Medicaid physical therapy benefit via federal community health centers, and would also add PTs to the list of medical providers eligible to participate in the National Health Service Corp Loan Repayment Program. The Expanded Telehealth Access Act, which would make permanent the current temporary policy that allows PTs and PTAs to deliver and bill for services provided via telehealth under Medicare. And finally, Optimizing Postpartum Outcomes Act of 2023, which is designed to address knowledge and access gaps for postpartum women in need of pelvic health physical therapy. We have a great team of paid lobbyists at the national Capitol, but we have the most power as constituents. So I'm hoping that next time we can get even more Minnesotans out there. And then this is another reminder to register for the APTA Minnesota 5K because it's only a month away. Hope to see you all there.